Welcome to Biohacking with Brittany. I am so excited that you are listening today. If you are new, welcome. I know there's so many new people here, and I'm really excited that you are joining. I am recording this at 6 a.m. So, mind you, if I'm drinking coffee while you're watching this video, that is why. And I'm also in my husband's office. My whole family is sleeping, so I'm in the basement trying to get this episode out because it's so important and so timely for the peptide world right now. I am Brittany Ford. I'll just introduce myself. I'm a registered holistic nutritionist, board certified in longevity medicine. I have done work and certifications in functional health as well. And I am a podcaster, content creator, mom. What else? I think I'm missing something. I don't know. But I've done quite a lot of things and I really focus, women's health practitioner, there you go. I really focus on women's health and longevity as my core and have been for a long time. I'm a biohacker and I have been honestly talking about peptides for a very long time. The first podcast episode I did on peptides was from 2021, which is crazy to think about. So really excited about today. This is a really important time and moment in peptide history. So this is a landmark day. The FDA advisory panel has voted yes to opening the door for compounding pharmacies to make some of the most popular peptides in the world. I'm going to break down exactly what this means for you, what this means for women, what this means for Canadians, and what this means for everybody globally as well. I am based in Canada. Almost all of my clients are in the US or global, and same with my audience, same with my listeners. So we're just going to break down what this means for everybody depending on where you live. So I guess I'll just back up here. The current situation with the FDA right now with this meeting is that it's a 2-day meeting, and I'm recording this on 6 a.m. of day 2. So we just had day 1 yesterday. I watched the whole thing live because you can watch it live on YouTube, and it was spicy. It was actually very entertaining in moments, and I'll get into that later on. But it was so interesting to see people arguing and people referring to other people's like things that they had said earlier on. And there were definitely some funny things that were said too. And I didn't expect it to be so spicy and heated, but it was, and it was really interesting to see. So I watched the whole thing today, day 2. I'll be live on YouTube watching it because it's so important to know exactly who's standing up, who's saying what are both sides of the argument so that I can make informed decisions for myself and for my clients and my community. So that is where we're at. And the most important thing is that, and I want to talk about this, is these peptides moving in the way that they did yesterday and today will push them into mainstream and will push them into being a household word, right? Right now, when you say peptide, yeah, a lot of people know about peptides, but it's still got this like, I don't want to say stigma, but there is a bit of stigma with them. And it's still got this like buzz to it, right? It's almost like, well, I guess it's not the exact same thing, but it is almost kind of like when, you know how before cannabis like was legalized and the way that you would buy it is like you would buy it through friends and suppliers and that type of thing. And everyone was doing it, everyone was talking about it and that type of thing. And then it became legalized and now it's just part of society and you can buy weed like down the street, right? It's that same thing is like it has this weird like buzz to it still, and we are finally moving past that because we are able to have recognition of how much people are healing with these peptides, which is absolutely incredible. And yeah, it's really exciting. So I'm going to talk about what happened. I'm going to talk about each peptide, what it is, how to actually use it, and the benefits, and what this means for women. Like I talked about, depending on where you're living, the gray market, telehealth, and what this really means long term for us. So let's talk about, first of all, the big moment, what actually happened yesterday specifically. So you don't get confused. It's not like these are suddenly approved So the FDA's Pharmacy Compounding Advisory Committee, which they call PCAC, which is literally the whole meeting all day. Sounds like people are saying peacock, but PCAC voted to recommend adding BPC-157, KPV, TB-500, and MOTS-c to the list pharmacies can compound. So all four that got talked about yesterday live got approved. And when I tell you, I was shocked because, again, I watched live. And so the first one was BPC 157, which had the longest discussion, had the most debate, and delayed everything coming afterward. When this went through and approved, because when you watch live, right, it shows you who voted yes, who voted no. It shows you the tally. And after they vote, these people on this advisory committee, everyone has to go around, by the way, say what they voted for and say why. It's pretty wild and interesting. And I was like, oh, okay. So you have to claim your vote and it's not anonymous or anything like that. So after this first vote went through the BPC, there was an audible gasp in the room, because what happened is there's a whole room, there's the public there and you can see it on camera. There's all the people sitting. Think of going to a jury or that type of thing. There's people sitting on these chairs, and then there's the committee that actually votes, and then there's the podium where people go up and talk. And there was an audible gasp of when it got approved. And even me, I was watching, I was like, shocked. Did not think that was going to happen. Honestly, I went into yesterday being like, none of this is going to get approved. We're going to be sitting in the dark ages for who knows how many years. So that is amazing. All four of them got voted on yes by this advisory committee. Now, why this matters, there's a couple of reasons that this matters, is that the FDA going into this, the actual FDA scientists said no. So the FDA scientists, the scientists that recommend the FDA, that are recommended by the FDA, before this said no to all seven. So the four yesterday and the three today, they said no. This advisory committee voted against what the FDA scientists said and voted yes. That doesn't happen very often. Okay, so that is why this is like, whoa, right? And I'm going to get into some controversy in a second of what people are thinking of why this might have happened. The public showed up, first of all, and that was really cool to see. So the panel heard from more than 24 speakers over roughly 2 hours on BPC 157 alone. And this is the moment with real people behind it. I saw people standing up of people who own telehealth companies, doctors, clinicians, all types of people talking about peptides. And from both sides, people are saying, yes, you should do this. People are saying, no, you shouldn't do this. Peptides have a champion at the very top. Obviously, we have RFK Jr., and the health secretary has openly called himself a big fan, saying that he uses them and he's making this a priority, moving peptides forward. What is exciting about this is that we are going to be moving, hopefully, from this wild west of the gray market of peptides to more of a regulated, pharmacy-made, quality-controlled, safe space for these peptides. This is a big win for everybody, including myself, including everybody who uses them and orders them, and everybody globally as well. There were some stats that were dropped as well yesterday. One of them was telehealth's next multi-billion-dollar market is peptides. And one former FDA official cited this being a $2.2 billion opportunity. So you don't get something like that if people are not getting real results from them, right? Like you just wouldn't see the industry, you wouldn't see the opportunity like that. I pulled a couple quotes. So one man said, this is Dr. Halim Mohammed. He's from Game Day Men's Health. I actually have a client who uses Game Day. And he said, he's a physician panelist. And he said, as a physician, I have to keep patients as safe as possible. So when I look at saying no and pushing it to the gray market, am I doing greater harm? And I love that perspective because that's literally what's happening right now. So why this is a win for the people, the biggest benefit here is safety through legitimacy, right? So right now people buy peptides from websites. Some of those websites and suppliers are sketchy. They are unknown. How can you trust them? We don't know. And this will actually help push towards licensed pharmacies making them under real quality standards. It will be more accessible and it will be done right. So you will have to have a prescription from a clinician filled by a licensed compounding pharmacy. It's a huge upgrade over a mystery vial that you might get from the internet. It validates a huge, fast growing community. So peptides are going from what is that? What are you taking to a federal vote and national news in a couple of years. So this is so important. A few things here is that it's only going to be these peptides that are spoken about today and yesterday, right? It's not going to be all peptides, which means, and I mean, we still have to have the FDA vote in itself, but if that goes through, but my point being is there will still be a gray market after this, no matter what, because there will still be peptides that people will want that will not be able, you will not be able to get through a prescription. It just means that if this does actually get the final approval by the FDA, you will be able to get this through a compounding pharmacy. So you will be able to go to telehealth, go to your doctor, work with somebody like me. I'll recommend you to the telehealth compounding pharmacist, and you will be able to get your BPC-157 through a prescription and trust the source that you are getting it from. Now, if you want something else, like say you wanted something that hasn't been talked about yet, like C-Lank, right? Which is one of my favorite ones for anxiety and stress. That is not on the list of 7 peptides right now. That means that you would have to still go through these private companies and have to go through a private gray market peptide company that you trust. And that is why I have my vetted sources available for everybody. It's literally free on my website and you can go and get it because I wanted it to be accessible to everybody in Canada, US, and global. There are so many peptide companies. And I tell you this so honestly, I get pitched to be an affiliate for a peptide company almost every single day right now. Oh, join my affiliate program. We do this and that. And I don't answer any of those emails, like zero, because I have my trusted source in the US, Canada, and global, and that's all I need. I don't talk to anybody else. I don't trust anybody else. And every single vetted source that I have met with the founders, face like on a video call, like not, oh, over email, hi, like literally we've talked. They've sent me their products. I use them myself for my family, for my clients, would not ever recommend anything otherwise, right? And so that is so much due diligence that I had to do in order to find products that I personally trust that are vetted, right? And so that is what I recommend all my clients to today and will continue to. Now, that will change, I said, once this telehealth, if this telehealth industry is able to take off. Like I said, so it would move towards a recommendation to it being prescribed through a prescriber, depending on the country that you're in, and then everything else would stay with the vetted sources. It validates this huge, huge market and community. And that is why yesterday was such a big deal. Like, it's a big deal, right? Because they voted yes, and the FDA scientists said no, right? The committee said yes. That's a big deal, right? But it's also a big deal because it just got national validation. The doctors, the clinicians, the companies, the people who stood up at the podium talked about all of their clients, talked about all of their patients getting success from these peptides. Hundreds and thousands of Americans, only in America, right? Like, this is not even a global situation. Just America are getting success with these peptides, if not millions of people. And so for those people to finally have a voice and be heard and be seen is massive. This validates every single person using peptides. It does. It really does. Like, it doesn't matter where you live, it validates you using peptides because it shows there are so many people using them and getting so much success that now we need to move forward with this. They need to be compounded. We need to have safety regulations for them. So I hope that if you're listening to this and you are using peptides, you should be celebrating because you now have more validation behind your actions and behind you using peptides. And you should share this with people that you know. If you are on the fence and you're like, oh, I don't know, like, what about these side effects? What about this and that? And oh, I've seen all the fear mongering online. Again, just think about what just happened, right? There is so much demand, there's so much success, there's so much healing that is happening that it's voting against what the FDA says, and we are moving forward into the next steps. So, yes, you have every right to be concerned and you need to make the right decision for yourself. Absolutely. But just know that there are hundreds and thousands of people who are getting success with them, and you could be one of those people too. So, that's why this is such a big deal. And it's so, so exciting. Now, what I'm going to talk about next steps and what happens after this at the end of the day today, because it's not like suddenly these are suddenly on the compounding list, the 503A list that they're talking about. It's not like you can suddenly go get them. It's going to take time. And I'm going to talk about that in a second. The other stats that have come through that I've been reading about this, the broader biohacking market is projected to grow from roughly $38 billion in 2025 to $200 billion in 2035. That's insane. And peptides are part of that and one of the highest growing pieces that telehealth giants are so confident. One of them even bought its own peptide manufacturing facility ahead of this. Another quote, this is from Dr. Jessica Duncan. She said, many of my patients are already using these. The question isn't whether people will use them, it's whether they use them with a doctor and a licensed pharmacy or completely alone. Now, mind you, people are not completely alone. There are people like me who are supporting these people as well. But yes, a lot of people are just ordering and making their own protocols and things like that without any guidance at all. So the peptides that they actually talked about is BPC-157, and this one is the recovery superstar. This is probably is this the most popular? This is one of the most popular ones that people know about. It's kind of like a foundational peptide is the way that I view it. Peptides are they're short chains of amino acids. They are the same building blocks that make protein in your body. They are a short chain, which means peptide. If you have a long chain of amino acids, that means protein. These are messengers that speak your body's own language. Yeah, you have all of these. It's just about making more of them or having more of them in your body. So BPC-157, this is a 15 amino acid peptide whose name means body protection compound, and it's derived from a protective compound in the digestive tract. It works by promoting new blood vessel growth and blood flow to injured tissue, which is why it's linked to faster recovery. Commonly cited doses are about 250 to 500 micrograms per day, usually split dose like morning and night, subcutaneously. That means through injection. It's often injected into an injury site. So you can run 4 to 8 week cycles or even do 12-week cycles and then take a break afterwards. Reported benefits are things like tendon, ligament, and muscle recovery, gut and digestive comfort and health, joint relief, faster bounce back after injury. What I love about BPC is it's helpful for inflammation, it's helpful for injury, and it's helpful for surgery. So when I first started doing these peptides, I did quite a bit because I was still healing from my C-section. So that was important for me to have this and focus on using BPC for that. Right now, my own BPC dose is actually very low. Like I'm doing the minimum amount. And a lot of that is just the muscle recovery from the gym when I have sore muscles. And I kind of hurt my knee about a month ago when I was wake surfing. But after this round, I will take a break from it because I simply don't need it. My husband uses it for injuries that he's had. My mom uses it for joint health. She has sore wrists. And I put a lot of my clients on it. Anyone with gut health issues, anyone with any type of pain or muscle recovery, things like that. This is on the anti-doping banned list, so competitive athletes should know that, which is funny because that just shows you again how legitimized it is actually. It just helps you recover. It's not going to actually really help you perform better, but I guess through recovering better, you are performing better. But yeah, this is the one that people rave about, right? Like anyone who does anything from marathons, high rocks, anything like CrossFit, this is the one that they're talking about. The next one is TB-500. So TB-500, this is the recovery partner, and it kind of goes hand in hand with BPC-157. It is a fragment based on thymosin beta 4, which is a healing protein that lives naturally in nearly all of our cells. It supports the cellular machinery that lets cells migrate to a wound and rebuild, plus blood supply growth. It's commonly dosed, so there's a loading phase typically with it. It's about 2 to 5 milligrams twice a week for 4 to 6 weeks, and then about 2 milligrams once a week for maintenance. Weekly dosing, I said cycles of 8 to 12 weeks, and then you come off, very similar to BPC, except BPC you're taking twice daily. TB-500 you're taking once a week or twice a week. Reported benefits are whole body recovery, flexibility, tendon and muscle repair. And when you stack it with BPC-157, people call it the Wolverine stack. And yes, this is also anti-doping banned. So again, if you are recovering from anything, surgery, pain, injury, this is 100% what you would want to be doing as well. And I did do this when I was healing from my C-section. I was focusing on this. KPV, this is the anti-inflammatory gem. So KPV is a tiny 3 amino acid peptide derived from a hormone your body already makes. So it calms inflammation from inside the cell by quieting a master inflammation switch without the skin darkening of its partner hormone. Commonly cited doses are 200 to 500 micrograms per day subcutaneously, and it also comes in oral capsules and topical forms for gut and skin. And they did talk about that yesterday. They talked about the form, all these different forms. You can do this daily, often run during a flare or a multi-week course. So it depends on your symptoms, depends what you're dealing with. And the reported benefits are a calmer gut, soothed skin, and general anti-inflammatory support. This is a huge one in the gut health world. And lastly, we have MOTS-c. So MOTS-c is actually one of my favorite peptides. Is it the first peptide I did? I think it is the first peptide I did. So it is, yeah, I just love it. It's like an OG one for me. I find it so fascinating. It is a peptide that your own mitochondria already make. And so it's truly, truly native to your body. Levels rise when you exercise and they fall as you age. And how it works. So this flips the same metabolic switch as aerobic exercise, which is why it's honestly usually referred to as an exercise mimetic, like it mimics exercise. It's linked to glucose handling and fat burning. Commonly cited doses are 5 to 10 milligrams per week subcutaneously, sometimes split across a few doses. And it's often dosed around training days and you run in cycles of a few weeks. Reported benefits are metabolic support, energy, body composition, weight loss, and insulin sensitivity goals and endurance. So this is a big one for metabolic health, especially as we age. And there is early human data on a related version looked well and tolerated and very promising. So I love this one. I noticed a difference in my energy when I took it and in my metabolism. I did lose a bit of weight on it, not a lot, but I did notice a difference in my energy, which was more important for me at that time. And I ran it for probably 8 to 12 weeks, something like that, 2 to 3 months. And then I'm taking the summer off and I'm going to do another cycle in the fall. So I love this. I did up to 5 milligrams. What did I do? I was doing twice a week. I think I did up to, mm, I think I did up to 5 milligrams a week. I don't think I went to 10 milligrams a week, but I like slowly did more and more and more. And I noticed a difference in my workouts. I had more energy for my workouts, which is what I really liked with it. I really like MOTS-c for a lot of postpartum moms. So, especially the moms who want more energy, who are wanting some sort of metabolic body composition support, this is great for you. Especially because the GLPs are have a lot of side effects that aren't great for postpartum. MOTS-c does not have any of those side effects because it works in a completely different way. It is a mitochondrial peptide. It does not work through insulin suppressing appetite, suppressing thirst, causing nausea. It doesn't do any of that, which you can get from retatrutide or things like that. And then today, so for Friday, they're going to be talking about DSIP, which is a ME delta tide. That is what the actual peptide is called. It is a natural sleep peptide commonly cited around 100 to 300 micrograms before bed. Helps with stress resilience and deeper sleep. They're talking about Epitalon today, which is the longevity and telomere peptide with a devoted following. This is the one I haven't done yet, but I definitely would. Commonly cited around 5 to 10 milligrams per day in pulsed cycles, usually once or twice a year, and it's for anti-aging and sleep. And then the last one they're talking about is Semax. This is a focus and brain peptide. So you can even take it nasally and usually in the morning. And what's interesting is this one is actually an approved medicine in Russia already and has the longest real world track record of the group. Now, I think all three of these will get the same vote. I think they will all be voted yes. So, because I think just with the track record of them and the track record of yesterday, I think these all seven will be approved. There was a quote that I saw as well. This comes from the American Academy of Peptide Medicine, which were there. They had representatives there, and they said the committee voted to restore medical freedom and medical liberty for all of us. And I love that. It's very, very true. Now, I do want to mention that the voting, if you want to know specifics, was also on the free base versus acetate forms. And I just want you to know what this means if you see this online. So peptides come in two forms, a pure form called free base and a stabilized salted form, usually acetate, which is the same acid family as vinegar. Acetate dissolves and stores better, which is why it is common. The one practical thing to note here is that the acetate form actually carries a little bit of extra weight. So the same milligram number holds a slightly different amount of active peptide. A good pharmacy and clinician handle this precisely. And this is exactly why a pharmacy would be helpful for this, is just making sure it's standardized, labeled, consistent product so that you know what you're getting. So that's all that means is if you see the pure form, it's free base, acetate is the stabilized salted form, it just stores better and dissolves better. Okay, so what this means for women, let's talk about that. Peptides are a real opportunity for women, especially around energy, recovery, aging, hormones, fertility, menopause, all of the different phases that we go through. Women deserve to be studied and not just marketed to here. And that's just like with peptides in general and the entire market. A lot of the early peptide research was not designed around female physiology, hormones, or perimenopause at all, or menopause. It was done on male species or men if there is human data. That's not a reason to stay away. It's just to understand and be aware and to work with somebody and talk to somebody who understands how to take the research, take what we know about peptides and apply it specifically to women, which is exactly what I do. This is a time for you to be curious and get informed and do your research. And if you're listening to this, you're already doing that. But just know that peptides do have a place in your toolkit. It's just about which ones to take, how much to take, and where to get them from. The women, honestly, that I work with are usually pretty informed. Like they're usually pretty educated. They are proactive. They're all about preventative health. And so it doesn't surprise me that they will be the ones who will read the articles about all of this information coming out this week. What is really exciting, and this is like what I advocate for almost every day, is like peptides are not just peptides are not just for the bro science crowd. This is our frontier too, and we deserve a seat at the table and spot in the research. And on that, I was so happy to see so many women yesterday. So many scientists, so many doctors, people representing companies or the public or whatever, like, or even representing the FDA. So many women yesterday were at the FDA meeting, and that made me so, so happy. There was a lot of representation, and that was really important. Okay, now let's talk about the future. This is what we need to talk about. This is what matters right now. So, today, and likely in the next few months as you listen to this, nothing is fully legal yet. These peptides were taken off of the FDA's high risk do not compound list back in April, but they are not yet on the approved 503A list either. The FDA gets the final vote and rulemaking. Okay. So, still today, pharmacies, companies are still in the gray zone. What this vote does short term is it sends the strong signal. Expect more telehealth clinics, compounding pharmacies, people to be talking about peptides now. They are going to go mainstream because this legitimizes them in a way we haven't seen before. And there will be a compounding boom that will come. When there is the final vote and rulemaking, that will change things. So right now, like I said, and after these, I'm assuming these three are going to go through today, the FDA still gets the final vote. So they still get to decide, is this a yes or a no? And we don't know when that vote will happen. It will likely be end of 2026, 2027, right? So this is like a step in the right direction. Yes. It sends a national signal and legitimizes them. Yes. It is going to grow the market. Yes. Are they FDA approved on the 503A list? No. Will we know in the next year? Probably. There's like your short answer for everything. Okay. And obviously, I will keep you up to date as we find out what that happens, like when that happens and what that happens. The other part of this as well is that the rulemaking about these peptides is also done by the FDA. So they are the ones who can say, yes, BPC will be added to the list, but you can only get this amount. Or, but you can only get it refilled this amount. Or you can only get it orally, you can't get it. They're the ones who make those rules, right? And so we don't have any of that information yet, and we won't anytime soon. The gray market, it's not going to dissolve. It's going to shrink, but it won't dissolve, right? If this goes through, if the FDA says the final yes in the next year. The legal channel will pull a lot of people into safer sourcing, and that's amazing. And regulators will be able to actually go after these illegal human use sellers more aggressively because there will be a legal path that will exist. But the gray market will likely persist and continue for people globally and provide lower prices, no prescription, and seeking peptides that are not on the approved list. So it will always exist. The goal was never to ban peptides. The goal is to move people out of the shadows and into a pharmacy and something that's a bit more legitimized. So if you don't have a doctor, what does this mean for you, right? And that's the situation for a lot of Canadians. And so if you don't have a doctor, what does this mean for you if you are in the States? So telehealth is the doctor, right? And so the model will work like this, right? You will do some sort of online medical evaluation with a licensed clinician through a telehealth platform, and they will prescribe an appropriate compounded formulation if it's right for you. And then it will be filled through a certified US compounding pharmacy and shipped to you. That's what will happen. You'll just go on these websites and you'll be able to do that. You do not need to already have a doctor. The platform connects you to the prescriber. That is exactly why telehealth companies are so excited, because obviously this is a great opportunity for them. And yeah, that is why it's going to grow a lot. It's going to become extremely competitive. What is important here for Canadians is that this does not necessarily change things for Canada specifically, right? So this all happened in the US. The Health Canada has not approved anything. I don't even know. I don't think, as far as I know, I don't think there are any meetings coming up about peptides for Health Canada. So Canada is behind in that way. What this will do and has done and is doing right now is pushing pressure onto Canada and every other country, right? So you will still be able to buy them in this gray market zone in Canada through Canadian suppliers, but with it becoming more legitimized in the US, I'm expecting there to be voting meetings and things like that and pressure on Canada in the next year. Until then, it will stay as it is right now of it's not through prescription. You go through a clinic, you work with somebody, you go through a online company and you order them to your house. And that is the same globally, right? So it depends on the country. Like some of the countries I said earlier, Russia has some of these that are pre-approved or are approved as drugs, and that's a different situation. But most countries, it's the gray market, and you're working with somebody online to be able to order them and get them and know exactly what to take, or you just order and do it all by yourself. But the point here is that the US is really leading the charge now with this, and this will put pressure on all of the other countries to figure out where they stand on peptides. Are they going to move them to pharmacies as well, or is it going to stay in the gray market only? The big picture is that peptides are here to stay. You can zoom out whatever happens in the fine print of rulemaking. The cultural moment already has happened. Peptides just got national validation. A federal panel, telehealth giants, and health leadership are all pointing in the same direction. And this alignment does not happen around a fad, right? Like this means that there is true healing and success that is happening here. This is the beginning of peptides becoming a normal, accessible part of proactive health and longevity, and not a secret that you know about that you are ordering from random places or things like that. The vote did not just crack open a door, it signaled that peptides are becoming a real, legitimate part of how we take care of our bodies. And that is a very, very good day. And that's why I'm so excited. So I am so excited for you guys, and I'm so excited for myself and everybody who takes peptides, because it's just really, yeah, it's a good place to be in. So if you want to work together with me, you can. I work with clients all over the world through one-on-one. And what I do is I help create a full holistic 360 plan, including peptides, biohacks, lifestyle, nutrition, and supplements for my clients. So people come to me, they say, these are my goals, and I create everything for them. I give them for the peptides, which ones to take, how much to take, when to take them, where to get them from, how to reconstitute them. It's like a done for you protocol. It's amazing. And people have a lot of success from them. I have a ton of clients. So if you want to work together, I'm happy to do that. I specialize in women's health. I have a lot of moms. I have a lot of postpartum moms. I have a lot of women who are actually menopausal who come to see me. And we work on helping you feel better. So I am so excited to be offering that. And I have been for a while now. And it's really, really cool to see. And then if you want to look at my vetted sources, these are the companies that I use myself right now. Obviously, this is the reality. We are still not in this pharmacy age yet. You can go and do that. It's right on my website. I'll link it in the show notes below everywhere, so you can check that out and go do it ASAP. Order, take a look. And yeah, those are the companies that I trust, right? And there are hundreds, if not thousands, of peptide companies you can order from. So be careful because a lot of them you might not know or be able to trust that are actually legit, and people fake things all the time online now. So be really careful and take a look. You're absolutely welcome to take a look at my sources because, yeah, I want them to be free and accessible for everybody. What else? If you want to track your sources or if you want to track your peptides, I have my HerStack planner. It's a digital planner. It's great. And I'm actually coming out with a physical copy very soon. So stay tuned for that. Okay, guys, I hope this was helpful. I hope this makes you excited about using your peptides. Go take your peptides today. I'm about to go take mine right now, right before I have breakfast. And thank you for listening. Subscribe, listen to the show. I'm here to support you. If you have any questions, by the way, I should have said this earlier. I answer all my DMs. I do a lot of voice notes. A lot of women send me their health questions, very specific questions about what they're going through. If that's you, send me your question, right? Like, I'm here to help you. I have a lot of experience in this, and and if I don't know the answers, I will point you in the right direction because I definitely know people who will. So thanks for listening, guys, and I will catch you next week for another episode.